morning once again, church. So as part of our breast cancer awareness campaign, this morning we have in our midst Lieutenant Commander Dr. Joshua Cody, and he's coming to talk to us briefly on breast cancer. So with a round of applause, please let's welcome him.
Nativity. Nativity. Nice. Over the past few days, since we got into October, I'm sure you've heard a lot of people making a lot of noise about Pink October, Pink October, Pink October. Why are we making so much noise about October and saying it's pink? It's because we are talking about breast cancer. And this morning, I'm hoping by the time I leave here, you'll be able to take something away. This campaign was started a few years ago, and over time now, everybody has come to accept Pink October. I have a little challenge, however, with it, because many of us are talking about Pink October, but we are not doing the things that Pink October, the benefits that we are supposed to get from Pink October. So why do we talk so much about breast cancer? We are talking so much about breast cancer because in Ghana, it's the #1 cancer. If you take our population together, it's the cancer with the highest incidence. If you take men and women put together, breast cancer outnumbers all the cancers. If you take just women, breast cancer also outnumbers all the cancers. That's why we are making a lot of noise about it. Cancer is everywhere, but in Africa, we have a few peculiarities with our cancers. If you go into the Western world, in Europe, America, they also have breast cancer just like we have. But it will surprise you to know that for them, maybe out of every 6 breast cancer cases they get, only 1 will die. What happens in Africa? What happens here in Ghana? And I'm not talking to you as somebody who is reading statistics. I sit in the clinic every day, and there's no Tuesday or Wednesday we go to the clinic that we don't get at least 5 breast cancer cases. So I said for the Western world, out of 6 who get it, 1 will die. Here, out of 2 who get it, 1 will die. That's how bad it is. So why are we making all the noise and still not making progress? It's because we are not detecting our cancers early. When it comes to cancer management, the key thing is picking up the cancer early. And for many people in the Western world, most of their cancers actually are not cancers you can palpate. I know we are teaching you a lot about how to palpate and pick up lumps. But the benefit that people in the Western world get is because they do active screening exercises, they don't even get lumps. By the time the thing is very small, an ultrasound or a mammogram would have picked it up, which is why I like what you are doing here today, because you are not just doing examination with a hand, but you are doing an ultrasound. Put your hands together for your health team here. That is being proactive. So we've also found out that still on the statistics, the peak age, if you go into the Western world, they are getting it, most of the people are getting it above 50, above 60. Unfortunately for us, our people are getting it between the ages of 35 and 50. So we are getting very young people getting breast cancer. That is why we are making a lot of noise about it. Again, because we are in church, we see many breast cancer cases that we know we can do a lot about. Unfortunately, I don't see the person at the clinic the next week. The next time I see the person, she comes to the emergency maybe 6 months' time, and the cancer would have advanced, and then she dies. Why didn't she show up? Because some supposed pastor said it's spiritual, and if she prays, the lamp will melt. You need to understand that we are also vessels God is using to heal you. We do not do of our own. It is God who gives us the knowledge. It is God who gives us the wisdom to be able to do. So yes, we are picking some of our cancers early, but people are not getting treatment early. That is why we are getting a lot of deaths. So today, if it so happens that you have a lump, you send it to the clinic, they do a biopsy and they say it's a cancer, please don't run away. Please don't run away. Let's do the treatment. So treatment will be either surgery, chemotherapy, or radiotherapy. Usually we'll do a combination of these. And I know when we mention surgery, everybody panics. But you see, in the Western world, because they are picking their cancers very early, they don't need to take off the whole breast. They just take off, they do what we call a wide local excision, take off just part of the breast. Unfortunately, we don't pick ours up early, so we take off the whole breast. But now, there's a lot of hope. If taking off the breast was your issue, now we have plastic procedures. After taking off the breast, we can do a plastic procedure for you to get you a breast again. So if that is your worry, don't worry about it. I'm not going to take much of your time. I'm going to sit, but before I sit, I'll just want us to debunk a few myths. When it comes to breast cancer, there are a few things people say which are not true, and I want to address them before I sit. Number one is that people say if you keep your mobile phone in your pocket, especially your breast pocket every time, and you are by a microwave, you get breast cancer. It is not true. Scientifically not proven. People say if you use deodorant, that is how you get breast cancer. It is not true. People say if you wear push-up bras, you get breast cancer. It is not true. People say that if your breasts are small, you won't get breast cancer. It's people who are well endowed who get breast cancer. It's not true. The risk doesn't matter. Whether your breasts are small, whether they are medium size or large, everybody can get breast cancer. People say only women get breast cancer. Not true. 1% of our breast cancer cases are men. They are men. People say it's only older people who get breast cancer. But I've already told you the age range for us, we are picking up our peaks between 35 and 50. So that, again, is not true. People say, this one is very controversial, but men sucking your breast prevents breast cancer. It's not true. It's not true. What we say is, they may help pick it up, but it doesn't reduce your risk of getting. Once maybe your partner is, there are some people who have come to the hospital and they didn't pick up the cancer. It's their partner who maybe picked it up. So that is what we mean by, we encourage people to suck. But we don't say that by men sucking your breast. It is not true. Please, I beg you. And I know many people are riding on top of that. Please, today, it's not true. People say that if you don't have a family history of breast cancer, then you will not get breast cancer. That is also not true. Yes, if you have a family history, you have a higher chance, you have a higher risk of getting breast cancer. But we are picking up many people, let's say about 70 to 80% of the cases usually don't have a family history. People also say that every lump that is seen in your breast is a cancer. It's not true. Only about 10%, so that's where the good news is. Only about 10% of lumps in the breast are cancerous. So there's a big 90 that are not cancerous. Then people say that breast cancer is a death sentence. I can tell you today that breast cancer is not a death sentence. This is not theory. We have picked up cancers very early, and I know patients who we have followed up in the clinic up to 5-6 years who are going about their normal life and they do not have any issues. I won't want to bore you a lot. Thank you all very much. Please go down, get screened, get examined. There's an ultrasound. Please take advantage of it. Like I said, the finger may not be able to pick up some lumps, but things like mammography, things like ultrasound, they help pick up very, very small lumps. Thank you all very much. Have a good day.
ushers will direct us as we exit. May we all have a fruitful week. Thank you for coming.